And I think Stephanie and Aislinn are going to be joining me for this one. We'll kind of be co-presenting. But just to briefly introduce Aislinn, I don't know if you're on the screen, maybe my PowerPoint slide is blocking you from appearing on the screen, but Aislinn has been hugely supportive in helping us get some of these resources off the ground. She's an assistant professor at the Department of Health Promotion in the College of Public Health at University of Nebraska Medical Center. And she's been hugely instrumental in just getting these resources off the ground. So she's going to be joining me and Stephanie in introducing them to you.
Well, thank you so much, Izzy. Can everybody hear me okay? Can everybody see my slides?
Yes.
Great. Awesome. Well, thank you so much, Izzy, for that introduction and for inviting me to be here today, Dr. Owen, as well, to share a little bit about some of the resources we've worked on in the past, gosh, I think it's since 2021, and really kind of the future of where these resources are going. I know we don't have a ton of time, but I'd like to invite you, Stephanie and Izzy, to introduce yourselves again. I know you have already, but
I'll just say in the context of working on this, the purpose of the resources from a communication standpoint are, trying to build out, again, strengthen connectivity between our regions so that everyone is aware of each other's work that's happening, and also so that you're aware of opportunities to potentially collaborate with each other. So I'll just leave it at that for my intro, since I've already talked quite a bit.
To kind of go off of Izzy's framing of this question, as the program coordinator, program manager for IHEART, the way that these resources kind of play into what I'm doing, these are our bread and butter, right? The purpose of IHEART is to create this network of resources for students going into the healthcare fields. And from anybody who caught even the smallest bit of our previous panel discussion, it is very obvious that there are needs in terms of mentorship, and we are hoping to provide some of that in this digital format, through mapping, through a resource guide, and through registering to be part of the IHEART network. So from my standpoint, these resources, the importance of these resources cannot be understated, and they are going to serve as the groundwork for creating those networks of actual people with names and addresses, email addresses and phone numbers that we can pass our students on to from K through 12 all the way through graduate school, college, residency, to make sure that they are achieving what they want to achieve.
thank you, Izzy. Thank you, Stephanie. Okay, so we're just going to get right into it. These slides were developed through Menti. If you're familiar with Menti, what it does is it provides us some space and opportunity to engage with you all. It also has an open questions, comments, and answer, and it will help us kind of sift through what questions come up, as well as record those questions, because we do have a short window today to just kind of go through these pretty big ideas and products. And we want to make sure that we capture all the questions and comments that folks have so that we can respond to those later if we don't get through all of them during this time. So you can use a QR code on your phone. If you'd like to just access it on your computer, you can type in the www.menti.com and enter this code here. If anyone has any, oh, thank you so much, Rhonda, for plugging that in there. It's in the chat as well in Zoom. But if anyone has technical issues with getting on here and would like to access it, let us know in the chat. Okay. So here's kind of our rough outline. We're going to go into an overview, which I think Stephanie kind of already covered for us, but maybe there's a few more points we'll touch on. We'll talk about our registration form and kind of the process that we have that relates this registration form to these two products that Stephanie was talking about, which will be a guide in some format and a map, as well as some time for discussion and feedback and input, kind of similar to the approach that Izzy had taken with her previous presentation. So why these resources? I know we talked a little bit about these 2 points, Stephanie, Izzy, but if you have more points you'd like to bring up.
Sure. I'll hop in first again, just to kind of reiterate, and maybe it sounds a little unclear because we just refer to these resources, but we haven't showed you them yet. But what you will see today are essentially tools that we are creating to help, within the network of iHeart and within the regions themselves. One of the difficulties and challenges that we've come to understand is, communication itself can be challenging, both just, having the space, whether it's virtually over Zoom, or, in person can be quite difficult, I think, given how spread out many people are, even within their regions and their states. So we're relying very heavily on technology to really help facilitate communication and connections and networking within iHeart. So these resources are meant to address that, to try to fill in gaps in communication, and to strengthen what's already there. We also understand, there are so many wonderful, personal connections within our network where many of you already are colleagues with each other and know of each other, but our goal with this is to kind of create the space for networking and engaging within the context of the specific goals that we have for iHeart and what we hope to accomplish with it. So that's kind of, from, again, the communication standpoint, what we hope to accomplish through these. And I'll let Stephanie, if you want to jump in with any additional notes on that.
The name of the game here is definitely accessibility. We want to create resources for our students and for our program leaders that are not only, excuse me, that are not only accessible, but accessible on a wide scale. So something that's easy to use, something that is logical to use, and something that fits with the lifestyles of our students. So the goal here is to have something that can be referred back to over and over and over again if necessary, and that will be reflective of any new programs that are being entered, any programs that might change in terms of status. We want to keep it updated, we want to keep it relevant, and most importantly, we want to make it accessible.
Thank you, Izzy and Stephanie. And just a little bit of historical information about this as well. I had been working with Kirsten Olson and Dr. Owen, the University of Minnesota, since I believe 2021, to kind of develop the MAP resource. And then we also identified that there was a need for additional potential resources, and trying to figure out what is the best use case for some of these resources. And so I'm just going to go right into kind of, this is a draft, if you will, of our process as identified currently, and it kind of will inform what we go through from here on out. But this idea of sharing your program and entering a registration form, then there will be this review of, is this a program Indigenous-led and designed, which will then feed into, if it is, it'll be this map resource that is much more, I would say, detailed in some regards and interactive, and really includes some of those contacts and that different information that we want students to be able to find readily and easily accessible. This map, as well, as something that can be embedded onto a web page and will be in the future. And then if the program is not specifically Indigenous-led and designed, then it would be on a guide, which is a separate resource that is much more in development, I would say, phase as well. And then really the ultimate goal being here, right, that students find programs. They find programs, they find support. Okay, so now we're going to go into the registration form here. I will stop sharing my screen. So what we would like to do during this time, although we have short time together, is to kind of go through the registration form to ensure that everyone can see it and access it. And if they'd like to, you could also go through some of it together. And Stephanie, I don't know if it's possible to make the form just a little bit larger. Okay, wonderful. Can everybody see that form okay? Is it an okay size?
If you could maybe zoom in a little bit, Stephanie, just on the screen itself.
I've also shared the form in the chat. Great. And so this is just a quick overview, a lot of what has already been covered today in regards to what iHeart is all about. So you'll click next. Really, the idea is that this form would be completed by programs with program contact information for each individual program. This will feed into a database that's been developed that then feeds into our map resource, as well as a potential guide in the future. So what we'll do is we'll just kind of go through the process of filling out the form. So first name, last name, tribal affiliation if applicable, credentials. So that would include any type of professional credential, any other credentials as well. I think this could be an inclusive space to add other important credentials that we might not always think about, as well as an email address. And so what we're thinking of here is this is information that we would directly want to feed into something to help inform a student, right, in the future and identifying a mentor and identifying a program, someone to contact. And I think that there might be, on the email address, there might be some logic there. So you might have to put in an actual email address, definitely. Okay, and so now getting into organization and program information. What we're looking at here is maybe these individual level programs. And so we can kind of go through an example here with iHeart. And then within each program, right? Like, so for my example, with the University of Nebraska Medical Center, where I work, I'm a co-investigator on Youth Enjoy Science, which is a research education pathways program. So within the University of Nebraska Medical Center, that might be the organization. And so Stephanie, actually, if you want, we can just go with that example here. And then the program would be Youth Enjoy Science. And maybe even within our programs, right? So my program serves middle school through undergraduate. Each grade level and educational level has a different program. So what we can do here is, for are you an AHEC member, tribal college, university, tribally controlled, or VIA operated? We would not be at the University of Nebraska Medical Center. Program name, let's go ahead and put our high school program, which is going to be WISH, which is an acronym that stands for Week-Long Institute for Students in High School. And so this is just a program that we have for students in high school. And then, does this program primarily serve Native American students? Yes, it does. And so what we're looking for here, right, is your program specifically designed for Native American students? Sometimes we have these larger programs that fall under maybe underrepresented minority students, which would be the definition that we often use in higher education. But what we're really looking at here is our program specifically, we have been funded to work with Native students. Describe the leadership design of your program. So for our program, what we're trying to capture again here is this program Indigenous-led and designed, and would it then qualify to be on our map resource that we're going to show in a second?
Again, we really just want to try to center Indigenous programming, which is, again, Indigenous developed and led, and also which primarily serves Indigenous students. So these questions are essentially aimed at trying to hone in on those factors to make sure that we're giving priority to programs in that vein. And Stephanie, I guess we can just kind of continue down this list of questions quickly. As far as education level, again, this is just so that we can have a better understanding of how to communicate this program to students potentially. And as Aislinn, I think, had said, the map itself, we want to be able to showcase to students for them to interact with directly. So imagining, if I am a student, obviously I'm only going to be interested in programs that pertain to me if I'm a high school or middle school age student. So again, there might be some nuance here in that you might have a program that maybe overlaps with multiple age groups. And actually, even just, as we're troubleshooting this form, please feel free to let us know if you do see something about the way it's organized that maybe is not accurate or conflicts. I'm even realizing in this moment as we speak that perhaps should be a checkbox where you can check multiple educational levels rather than rather than just a single multiple choice, because I'm sure many programs overlap. So again, that's just to say that this is a work in progress and that we're we're also very open and happy to receive your feedback as you use the form to make sure that from the user end experience, it makes sense.
If you don't mind, I'm sorry to interrupt. It's Antoinette.
No.
So, I started trying to fill it out. It's a little problematic because I am co-director of Tribal Health Prime in California at University of California, Davis School of Medicine. So School of Medicine's not Indigenous-led. Neither is the Community Health Scholars Program, which is what Tribal Health Prime is under. So then that piece, I was like, well, is it or is it not? I don't know. So
Prime is though, isn't it, Antoinette?
what's that?
Prime is Indigenous-led though.
It is.
Yeah, so that's what you're promoting here is Prime itself.
Okay. Okay.
Yes, and to
Stop
Dr.
on that
Owen's point, it is to the program. And that's why we really wanted to spend some time going through this form, because we know it's very complex and that we're trying to capture the information in a way that we can then ensure we're getting it to our students and trying to figure out what is the best way to really elevate those programs, like the one that you have identified, to kind of the top, if you will, so that students can find those resources, really going back to what was shared in our panel earlier. So
Okay.
thank you. That was a great
Thank you.
question.
Thank you.
And so if that makes sense, we try to make this distinction of organization and program in the form. And hopefully that is identified there. And I don't know if we want to maybe even scroll back up, Stephanie, just to kind of look at that once more. Yep. So then organization at the top is really, that would be then in that example, maybe UC Davis or one of those would be the organization, and then program would be the prime.
This is
Perfect.
Melvina McCabe. While we're right there on that page there. So let's say the University of Nebraska Medical Center. They have several programs. Will they then receive an application to fill out
Yes,
for each
so
program? Will each program, okay, oh, all right, fine, okay.
yes, that is correct. That is how we've designed this. And so really what we're trying to think of as well is, and we've shared the map in last year's summit that we developed, which has gone through quite a bit of testing for user experience, user interface with students who are actively health professions seeking students, or even in M1s, M2s, different things to that nature. Within the region of Northern Plains. And so we're trying to expand this out now beyond Northern Plains. We've had a few program applicants within this form just from the testing, but we're trying to expand it out. And one of the things we were hoping to develop within this process is something that requires minimal development on the back end. And so that's why this form is intentionally designed that way, so that each program then is identified within this map at the place and location where it takes place, as well as not having this kind of larger, because in the past what we've found through this testing is that sometimes we try to collapse things down into one, when in fact there's very distinct and specific things within each program. And so I think if we were to scroll down here into let's see, some of the further questions about whether they're paid opportunities, whether travel's provided, whether meals are provided. So these are some of those details, again, that we wanted to be very specific about, so that students could identify programs that maybe fit the needs that they have, or know upfront, like, hey, this program would be able to support me in these ways, and so I feel comfortable applying for it. Okay.
Can I, this is Rita from NIH. Would government programs that are geared towards Native students be included in this, or not?
Yes, I think that they should be. Yes. Rita, thank you for asking that question. So like Youth Enjoy Science is funded by the NIH, we're funded by the National Cancer Institute. And we have some of our partners here at UNMC, like this, we have a SEPA program here that's specifically for Native American students. And that's also included in our map so far.
And Aislinn, I'm just going to hop in because there was a similar question in the chat about this as well.
Yeah,
I think
wonderful.
that
Thank you.
you can think of this Google form as sort of like a general IHEART intake form for programs that are pathway programs for Indigenous students in healthcare. So you might not be able to say yes to every question. You might not be able to check every box in the affirmative, but by all means, we would still encourage you to fill it out because that's what's going to get your program on our radar. And then when we have the information in hand, we can determine, you know, where that information can be highlighted. And as to kind of summarize again what we've already said, the GIS map resource, which is a visual map resource to highlight certain programs, is going to be the one that has, it's a little bit more focusing on centering Indigenous-led and developed programs. But there could be other opportunities offered through your organization, which maybe don't fit that specific criteria, but we can still highlight that for students in a different resource. So that's all just to say that if you even think that your program is if it's a pathway program for Indigenous students in healthcare, then we would encourage you to fill out the form, and that'll help us understand how we can best promote your program.
And that resource bank will also be easily available to students. It'll probably live on our website or somewhere like that, just like our GIS map. It's just, again, we're highlighting Indigenous-led, Indigenous in design, because this is an Indigenous program to support our students. Also, I think Stephanie or somebody mentioned mentorship earlier, that we're not quite ready for the mentorship arm of this. This is for pathway programs. I think Melvin or Dr. McCabe made an excellent recommendation that we do develop the mentorship, and that'll be, I think, the next logical step, but we're not there yet.
Yes, thank you so much, Dr. Owen, for that. Can everyone still hear me?
Yes.
Okay, great. So even like these questions here, can this be attended remotely? And again, this has been in development for about, now it's going on 3 years, and we've done a lot of UX UI. So some of these questions, we really have these informed from our own students' experiences. Within the YES program, I'm fortunate to have been funded in our second cycle. We've served over 250 students. And so we're really trying to lean on these experiences from this collective group working on this to ensure that we're kind of getting the best information we can available for our students. Okay, so then you'll click next. Now going into this part here, street address, city, state, and zip. So another really key thing here that I want to point out is this is specific to the program. So if you see program address, what we're hoping to identify here is the location of the program. So one good example that I'd like to use from, again, our programming at UNMC, we have some programs where we partner with a federally funded Native American education program that's in our public schools district here in the Omaha metropolitan area called the Native Indigenous Centered Education Program. And that program is delivered within the schools. So what we want to identify here, if we were looking at that program, is the individual school address, right? Or maybe this program address, so that the student would know, like, hey, this program is at my school, right? If that makes sense. So does anybody have any questions about that? Because I want to make sure that that's clear.
We had a really good question on the paid opportunity. I don't know if it's on here or not, but that just means stipend. Does your program offer a stipend?
Yes, that's a great question. Thank you, Dr. Owen. And we did try to keep that a little bit broad because I can say, I know from a university perspective, maybe federal government's perspective, that can mean different things, right? It might be paid in an hourly way. It might be paid as a stipend. It might be paid. So we just want to know, like, are you offering some sort of financial compensation for students' time? And we can provide maybe a further definition of that in the form as well. So thank you for that. Okay, so we can go to next.
Yeah. Can you see those questions, Aislinn?
Yes.
two people with raised hands. I think we're very close to finishing the form. So if you want to finish that, Aislinn, and then we can get to the raised hands.
Yes, that would be great. Thank you.
Mhm.
Okay, so then this here is, again, going back to Izzy's point about this is kind of like an intake form, like a registration form, if you will. We also wanted to identify what kind of information you would like in the future from a communication strategy perspective. Because we might have folks who are wanting to be engaged in ways like they don't have specific programming to that level, or would like to in the future develop programming. So that's kind of that information for you there. Then once you've completed that, you can click submit, and then this has been submitted. And then I can go ahead and I think we can go ahead and transition into questions.
Mhm. I think Madison, you've had your hand up for a while, so we can go to you first.
Thank you. So thank you for addressing the address situation. I was filling the form out while we were going through it together just for some ease. In our program, we actually offer 2 different college campuses. So we take high school students to 2 different campuses for a week. Everything's paid for. So I just went ahead and put in the college campuses that we use. Was that the correct thing to do?
Yes, that would be exactly what we're hoping for, so that students know. And this is, I think, really important when we're thinking about some of our partners. So we have programs where we partner specifically within the Omaha Metro. But then we also have schools that we partner with that are on or near reservations. And so for parents and for students to know, hey, this program takes place in Omaha, you'd be coming to Omaha is kind of important. So that's what we're looking for.
Okay, thank you.
And I think Gerald, you had your hand up next.
So well, I had one question in the chat. I asked if we should continue filling out if it wasn't specifically for the indigenous populations yet,
Yes.
but we're having conversations about adopting a program specifically for our communities here. And so if we fill the form out, we'll get the information coming back and forth and then update it as that program moves forward. Is that, yes?
Yes.
Okay.
Yes. And so we had a few more slides as well. And I apologize, everyone, that my power went out there for a second. But we will have, as we're developing this process, this kind of iterative revision of the map, because this form does go into a database that then will be fed into either the guide or the map, right? Based on that kind of distinction of Indigenous designed and led. And then that map, although it will feed into it in the way that we've designed it pretty seamlessly, it still requires this kind of manual refresh of the data in the database. And so that will require us to go back on our end, especially because many programs are grant funded, right? And we know that that is an ongoing challenge that can occur where students identify programs on websites that no longer are funded or exist. So that will be kind of like our end internally. And we've talked about kind of quarterly, but all of that's in development as well still.
Well, and I guess my other question was so part of our participants are from our local community here, but they would really like to specifically get it just for the community. And so that was my question. We have students participating in just the general program and encourage that. So I didn't quite know how to answer that question, but I think you did. So thanks.
Thank you. Thank you for your question.
And we might have time for just one more question from Melvina.
Yeah, I was just going back to that paid opportunity issue again. You know, and you may be going back to this later. I know this is just an initial intake, but to really ask about the types of financial assistance that students get is critically important, because the students can then look at that particular program and say, hey, you know what, they don't really provide what I need here in terms of assistance. So maybe I'll go on to the next one. In addition, I can see Dr. Owen applying for another grant after she writes up a paper on what resources are lacking for our students. You know, maybe there are plenty of scholarships out there, but there's not enough cultural resources for our students, et cetera, et cetera. And so then applying for another grant to assess those or to address those issues would be critical. So that's why I go back to that paid opportunity thing.
I'm gonna look to my mentor, Dr. Malvina McCabe, to lead that one.
I'll help you. I definitely will help you on that one.
Mhm. That's a wonderful idea, Dr. Owen. I would like to second that idea.
I have a comment. This is Laura.
Mhm.
How are you today? And I'm finishing my doctorate of public health, and I self-funded my education for the first time because I had scholarship and grants before. But I was thinking that maybe for the undergrads, I'm not sure if this is true, but on your FAFSA application, whether or not I'm going to look a region for conferences or special summer efforts. Indian Health Service under 103P does fund students to go on externs, which I did take advantage of. And then also there are grants like at Loma Linda, for example, to fund for conferences. And if you go to your medical school, you can also get funding to conferences if you're promoting the school. So those are some of the approaches that I took and am taking, but I was just thinking I'm going to check that FAFSA form to see if there is funding for that. Okay. A place to write that. Someplace to fund your, conferences, etc. Extra CME, so to speak. Okay.
Yeah, that's a great point. That's a really great point. I'd like to quickly go maybe to the form, to Dr. McCabe's point there. We do have different categories on the form, and I don't know, Stephanie, if you still have it readily available to share, and if not, that's okay. I can try to just talk through it. But we do have this idea of a paid opportunity. Then we talk about meals. We talk about travel and transportation, and these are all yes, no questions as well. So trying to get into some of those categories to that point, because we know that those are real things that sometimes are not provided. That might be barriers for participation, or on the other end, facilitators, if they are provided. So.
Yeah, I'm really glad you're breaking it down that way. AIP at one time, and I think this might help this program also. There was a donor who had made lots of money, but donated lots of money to AIP to assist Native American Indian Alaska Native residents and students if they needed to go home and have a ceremony done. So that gets to the cultural issues. If they needed diapers, if they needed utility support, that kind of stuff. So again, then looking for monetary support, always think also about your entrepreneurs who are out there and might be willing to give money for this kind of stuff. Anyway, just a short comment. Bye. Thanks.
Mhm.
Thank you. Thank you. It's a great point.
Aislinn, I don't know if there are any other really key points we want to impress on people now. Unfortunately, we've got a really tight schedule, so we will have to wrap up the discussion of this. But if you have anything you want to add before we move on, Aislinn, please feel free.
I just want to thank everyone again for your engagement, also for your patience during my power outage moment for a second there. We have a little bit more background information. If anybody would like to read out, I'm going to put my email into the chat. I know that this now is transitioning to being a part of IHEART and under IHEART as well. Although I am still working in collaboration with the group on this, and we would always welcome any students as well who'd like to learn how to use Tableau, how to use ArcGIS. I use Mapbox as well. Who would like to work with us. I know this is something we had offered last year, and we just want to open that back up. So I think that's the main thing I'd like to just add there, and emails in the chat. Thank you again, everyone, for your time and your input.